First of all, I welcome all of you for this awareness program on colorectal cancer. Colon is one of the very common actually in Goa. It may not be as common in India, but in Goa, we are actually the worst state in considering the colon incidence. We have done a little study and we found that more Goan population are likely to get more colon cancer than any other state population. But compared to USA and all, we are much better. So let me start the session by welcoming all who are on the board. Colon and rectal cancer involve the lowest part of the digestive system. If you can see on this, I have seen the large colon, which is like starts from the appendix right up to the rectum. There is ascending colon, there is a transverse colon, then there is descending colon, and there is a sigmoid colon, and then rectum and anal canal. So this is the division of this larger content. The small intestine cancers are extremely rare. The other cancers in the digestive system starts from the oral cavity as such, esophagus, and then the stomach, which is common, but the small intestine is very less. But compared to that, colon cancer, I mean, वडली आतडी म्हणतात. The वडली आतड्यांचे cancer जे आसा are little bit more common compared to the other things. And as I have told you, परत तुमका सांगता की गोया, it is more likely that you will have a colon cancer than any other state in India. But compared to the Western states, we are much better. It usually starts as a small growth. It all starts as a small growth, and the हळूहळू वाढतं. I mean, polyp म्हणतात. It comes as a polyp. We starts with a polyp, and then polyp grows into, and then it forms a cancer. Now, if this is the incidence in India, incidence, I mean, all 100% घेतले, there are only 5% is around colorectal cancers. Today we see 100 patients, suppose of all types of cancer. Out of them, 5 will be colorectal, around 14 will be breast cancer, around 10 will be lip and oral cavity cancer, around 10 will be cervical cancer, and rest other forms a big group. And lung cancer also is around 5. So compared to other, it is one of the commonest cancers what we see in India. And males are more likely to get cancer than the female. That means darliang third cancer compared to the bailang. And it is almost double. Around 2 males can get cancer, 1 female will get cancer. So it is much higher incidence is in the male population. Compared to USA, in USA it is very high actually. It's like in your lifetime, it is almost like 1 in 20. 1 in 20 will get colon cancer. This is quite a high number. But because of that diet is much westernized diet. They don't have a lot of vegetables inside. They have a lot of red meat and all those things. I will tell you later on why it is so. So these are the risk factors. This is very important. This is a slide which you should remember. There are some risk factors. Risk factor, see, it is not in our, everything is not in our hand. There are some risk factors which cannot change, and there are some risk factors which can change. That means you can behave properly and you can have your lifestyle properly and you can change these factors. And there are some factors it is absolutely not. I will first let me tell you what are the risk factors which we cannot change. The most important is age. It is not in our hand. We are going to grow old, and as you grow old, the chance of getting colon cancer automatically increases. Then if you have a family history, suppose your parents have a case of colon cancer, and it just started as a polyp, then you are sure that you will also maybe at higher risk of getting cancer. Then suppose you already have a polyp inside you, then you are likely to get cancer in a higher number. And if you have ulcerative colitis or any inflammation, Crohn's disease and ulcerative colitis, inflammatory cancer infection is there in the colon, then also you are, see, this we cannot change because it's already there in your body, or it is there in your family, or your age is increasing. Other risk factors are very important because on that you can control. That means one is your physical activity. Most important is the more the obesity widely to the cancer, the chances of colon cancer also increases. Plus many other cancer also will increase with obesity. Physical activity is extremely important. You must have a normal walk, at least 2-3 kilometers walk every day. Have a good exercise. Control your diet. Diet is extremely important. Jataditke vegetables is very important, because we feel that if you have more red meat, then the chances of having colon cancer increases, and that's why in the Western countries it is much more compared to Indian company, because Indian people, in spite of eating non-veg and a lot of red meat also, they always have a vegetables in their diet. They always consider some early palak, or like mulo and all those things, tamari bhaji. All these things are a part of our natural diet. Smoking, as you know, is also an important factor. Processed meat means tin food which comes. There are a lot of people who don't want to have fresh food, fresh fish and fresh chicken, fresh mutton. They like to buy already tin food which has contained a lot of preservatives and water. Processed meat is a very high risk factor for colon cancer. Why this diet is important? Because all this diet, if you have a lot of non-vegetarian, if you have a lot of red meat, then you tend to get constipated. Because daily sandas are regular. So whatever is supposed to come out every day doesn't come out. It remains inside your colon. It gets harder and it gets continuously in the same place. It gets irritation is happening, and then you can get over a period of time polyp, and then polyp will grow into the lung, colon cancer. So these are there are like smoking you can control, obesity you can control, physical activity you can control, diet you can control. These factors are there in your hand, and you can control them. While age, family history, already suffering from diseases is not in your hand. So compared to that, this is a very important slide. This is a way you can decrease your chance of getting colon cancer. In Goa, if you see, our almost 40% population, that is 30% of around Christian population, 10% is around Muslim population, they love red meat. At the same time, the Hindu population also like to eat a lot of red meat. Like mutton, we say red meat means mutton, which is like beef, pork, and all those things. All full population enjoys this food, but that's why maybe the rate of colon cancer is high in Goa compared to other states in India. But we are much better than the USA and other. But we are, if you don't take care, maybe over a period of time we will go towards the USA, and where the risk factors are almost 5 to 6 times more common to have a colon cancer than us. Now, when you should come to the doctor, this is also very important. That means what you will feel. What are your symptoms? When this symptom comes, then you must come to the doctor. See, these symptoms may be a very common symptom. They are not something specialized to colon cancer only. But when you have them, you should consult a doctor. That is a very important. Just consult a doctor, so that he will decide. The doctor will decide what tests to be done, and then he will decide how the things will go on. The most important thing is bleeding from the rectum. Suppose blood blood is very important. Suppose you bleed from the rectum, most likely 90% of the time it may be piles or fissure or something like that. But that you don't take decision, because what happened decision, no, this will be piles, this will be piles. I don't think I should have any other problem. They will try to control take medicines, go to some quacks and get some treated, and you don't do the test. And then what happens that it takes long time for all these things, still the blood comes, and then you go for testing. So you are delaying the diagnosis. So any blood in the stool, you have to take it very seriously. First you investigate it is not cancer, then you can go on treating your piles any number of times. The second thing is abdominal pain, some vague pain. You just don't feel okay. Continuously there is a pain in abdomen which does not subside by regular your medicine. Anything it continues for more than a month or so, continuous pain is there. You need to investigate. You can get your ultrasound done. You can get your CT scans done. The doctor will advise you what to do. Then the next most important sign is a loss of weight. With losing blood in the stool, with pain in abdomen, with loss of weight is a dangerous combination. So if loss of weight is there and abdominal pain is there, you have to investigate. It may not be only colon cancer. There are so many other cancers like stomach cancer, other intra-abdominal cancer can give rise to all these problems. Then you have what is called as low hemoglobin. You have done your blood test suddenly and you find that the hemoglobin is around 5, 6 or 7, and you have never even seen the blood in your stool. That means occult blood is positive. This is a very dangerous. That means there is a right-sided colon. There is a right-sided colon, which is can see here, which is the start of the colon. Because by the time it comes up, it doesn't remain as blood. It just becomes black stool, and you don't notice that black stool. And you lose on continuously losing blood, and your hemoglobin goes down. You become fatigued. You don't feel like working. By late evening, you become tired. All these symptoms are very important, and that needs to be investigated. And the most important other thing is there is a change in bowel habits. That means you have a definite habit that you used to get up in the morning at 6 o'clock, have a lot of water, then go to the bathroom, have motions, regular motions, and then you come out and you have to follow your everything normal routine. Suddenly you find that no, you have to get up at 4 o'clock, you have to run to the bathroom, or you don't, 1 or 2 days, you don't get the sensation for motion, you get constipated. So alternate diarrhea with constipation, or blood in the stool, or blood and mucus in the stool, all these things, that means your regular habit of passing motion changes. So there is a change in pattern of your bowel. Then you have to consider is an important sign, and you must, it may be just simple infections, it may be colitis, maybe ulcerative colitis, maybe Crohn's disease. But first thing is to that you have to rule out cancer, because rest other things can wait. Even if you delay for something for others, they can take some time. But important is you have to diagnose cancer, because these are potentially curable cancer. If you come in time, you can totally get all right. We have patients who are now 20, 30 years, absolutely hale and hearty, or regular things, they can do everything normally. So I don't want to miss these things for this call. And that's why timely intervention is very much needed for this. So what can blood in the stool tell us? It's a very important. Blood in the stool, it can bleed from colon, rectum, polyp. It can be a polyp, it can be a cancer, it can be even stomach, something is bleeding, it will become a black color stool. If you have a black color stool, that means the bleeding is either in the right side of the colon or it is in the stomach. If it is a fresh blood, it will be on the left side of the colon, and it can be in the rectum or anal canal. So all these things is a very important part. And almost if you take a general population, if you take something like almost 30 to 40% of the people will have some sort of blood in the urine. But that does not mean all of them will have cancer. But as I have told you, it is very important. First, you rule out cancer, because that cannot wait. So change in excretory system, your bowel system has changed. Diarrhea, alternative is constipation. The size of the stool has come down. That means something is, you have to force to pass stool, or the size becomes thinner. Then is a blood in the stool or in the rectal bleeding. You feel exhausted and you have lost weight. This is a combo for something in the colorectal cancer. Chances are extremely high. So change in bowel habits, as I have told you, it can be have diarrhea, it can be have constipation. All this change, you have to come immediately to the doctors. Weight loss, extremely important, but not only in colorectal cancer, but in all the other cancers. Weight loss, if we are not planned for weight loss, and you don't have thyroid problems, and then simple just you are having normal diet, you are everything normal, suddenly you find that over last 1 or 2 months you are losing weight, you have to see for all other types of cancer as well, not only of a colorectal cancer, but all other type of cancers also there will be loss of weight. As I told you, abdominal pain also, in bloating, fullness, cramps, a lot of people make it looks like a acidity. They will tell you that no, I have got extreme acidity, I have got gas formation. So you tend to little divert your mind to stomach more when somebody says about gas. But bloating, fullness, cramps in the stomach can be a problem for colorectal cancer, as well as the stomach cancer, as well as any other disturbance. Liver and the pancreas also will give you more or less same. But important part is you do investigation, you get yourself investigated, and then you will know the exact cause of these things. Anemia, almost 23% have got anemia, which is unexplained. Unexplained anemia, that means you are not doing diet, you are not having blood loss from anywhere. Still you find that there is a loss of hemoglobin. You have to rule out right side colon cancer, that is 𝐒𝐡𝐞𝐤𝐡𝐚𝐫. We have seen so many times in our practice that just hemoglobin, lot of GPs and lot of other doctors continue giving you hematinics. I mean, iron, take iron, take iron, take iron, give them injectable iron without investigations. And after some time, we find that it has become because of right side colon, because they feel that there is no blood in the stool. So why I should investigate? But black color stool, or occult blood positive on the stool, simple testing of occult blood in the stool can save you from potentially this dangerous disease. Loss of appetite, I have told you, extremely important. Fatigue, because you are not eating well, your hemoglobin is less. So automatically you feel like, fatigue, you don't have that energy, levels go down. So all these things are extremely important. So these are the all symptoms when you should come to the doctor. Now, the types of screening are important. First is your blood in the stool. It can be done manually. Even if you do suppose simple, it doesn't cost also much, not even 50 rupees, I think, it will cost you. So if you really do it maybe once in 6 months, once in a year, just you do your stool test. And if you find that there is a occult blood, and you can do actually, you can stop eating non-veg for about 2-3 days, and then you do the test. And then you can get 3 days continuously testing, and all tests are negative. Very, very unlikely that you have any bleeding in the colorectal cancer. But even one sample is positive, you need to investigate properly. Once in a year is advocated, but once in 6 months, because it's a very cheap investigation, you can do blood stool for occult blood once in a this. Then the second one we can do is a enema. Previously we used to do enema, double contrast barium enema. The barium enema will tell you the picture suspicious is there, but it can miss very early cancers. And it is like it is not a very pleasant this to do the test. Maybe once in 5 years you can do this, which is in a suspicious patients, which are in a high risk patient. You can do it early. Colonoscopy is something important. This is very important. Like endoscopy, now everybody knows that endoscopy of upper GI. For ulcer, for anything in the stomach, esophagus, we do upper GI endoscopy. That means we put a scope, we put a long tube, black color tube through the mouth, and you study the stomach and all this. For a colon to study, we have to put it through your rectum. There's a long tube which goes throughout, and it's a simple, safe procedure, little bit uncomfortable, but we use a long tube and light at the end and camera, and you can see on this, if there is anything, you put some gas inside to distend that colon. So if anything is even a small ulcer is there, small polyp is there, any growth is there, we can see that. We can take a biopsy of that in case it needed. If it is simple polyp, we can do a snare polyp. That means we can excise the full polyp and send for reporting. This is like a full colonoscopy. You can write from colon, you go ascending colon, descending colon, right up to the cecum till opening of the ileocecal valve, and then you come back and you find nothing. That means you are happy. Once you have colonoscopy normal, minimum 2-3 years at least you don't have, unless you have symptoms. Otherwise, you can do it once in 5 years also. Flexible sigmoidoscopy, you see only left side, because 75% of the cancers of the colorectal म्हणजे cancers 75% is only on the left side. That means rectum, rectosigmoid, and the descending colon, sorry. So only on the left side of the colon is around 75. So 25% is on the right side, 75% on the left side. So you can sometimes do only flexible sigmoidoscopy if you have symptoms. Virtual, those which don't want to have this full procedure, you can do now scan, CT scan, high-end CT scan, which can put a gas inside, and you can see the colon properly in case you can make a, which is called a virtual colonoscopy. That means you actually don't do, but you see through the virtual colonoscopy. So here is this, we have shown you the blood test, how they do is a very simple stool for occult blood test we do. Then there is, we can test the DNA also in the stool. That is a little higher one. It is very costly method, is a new method, and it can detect something like colon, some genetic, this is there, aberrations are there, then this likely that you may have a colon cancer. It's a very costly test, but simple test is just stool for occult blood, and it's nothing cost more than 50 rupees to maximum 100 rupees. So this is on my left side, that is a double contrast barium. That means we pass a barium, which is opaque, through the rectum. First we prepare the rectum, pass that barium, and then you pass a gas, so that there is a distension of the colon, and you can see this small area of narrowing which occurs in the colon, and then we can detect that yes, this can be a colon cancer. Then you do a colonoscopy because you need a biopsy. The negativity of this is that we can't get a biopsy. We just think that it is a colon cancer. On my right side is a sigmoidoscopy, which is going up the left side. You pass a long tube of the sigmoid, you can study right up to the descending colon, rectosigmoid, and the rectum. And best part is you can take a biopsy. Suppose you feel suspicious area is there, just take a little tissue and send for reporting to, this is just a simple colitis, or it is a little polyp is there, some diminutive polyps are there, some ulceration is there, some growth is there. You can just take a biopsy, send for reporting. This is called as only left side. If you see, it is sigmoidoscopy. And this is the colonoscopy. This is the colonoscopy, is a colon. There is a biopsy forceps also you can put inside. You have a light source there. You can see inside. You can pass a snare through and you can take out a polyp which is seen here. So you start from here. You go on the left side, rectosigmoid, go on the ascending colon. Descending colon, then transverse colon and ascending colon, right up to the junction of the small intestine to the large intestine. This is a little bit uncomfortable. Sometimes we just give it under mild sedation because we are putting, when you put a gas inside, you feel uncomfortable. You can see like this polyps, small polyps. You can see, you can just take a snare polypectomy at the same time. You can take a biopsy of them. You can have a light, you can distend, you can see absolutely if you have ulcerative colitis, something like, ulceration, anything is there in the colon, you can pick up. See, there's a difference between barium enema, double contrast, and the colonoscopy. Is like you are watching a road from a helicopter and actually walking on the road. When you walk on the road, you can see even small potholes. But if you are seeing from a helicopter, you may just see there's a road inside. So there's a difference. That's why colonoscopy is extremely important, because you can see absolutely, bang, means very unlikely that if colonoscopy is normal, then you develop a colon cancer within next 1 or 2 months. Extremely important. Nobody can miss this. And we have got expert gastroenterologists doing all these things, so they can you can have a confidence in them. Then something called as virtual colonoscopy, which is called like CT scan. You do a CT scan, high end, put a gas inside, do a CT scan, and you can see the if there is any abnormality is there, then you can pick up very fast. Now we come to the cancer stage. How many stages are there? You all know that there are 4 stages of cancer. Stage 1 and 2 we consider as early cancer. Stage 3 is the middle part, and stage 4 is a very advanced cancer. Now stage 1 is the cancer because when you see the colon, if you see the colon, it is like a circle. So if it is within, just for your sake, I don't go into too much of detail, but if it is localized cancer only into the intestine, that means it is only inside, because it starts cancer from here and it goes this way outward. So if it is limited to the cancer colon, we can call it as a stage 1. If it is limited just coming out of the colon, that means into the serosa, and maybe on a small node positive, you can consider as stage 2. Multiple nodes positive, it becomes stage 2, or locally it is a very big tumor coming out of the intestine, it becomes stage 3. And once it goes to the liver, or you have ascites, once it goes to the other organs, it becomes stage 4. Why this is important? Because this is important because your survival will depend on which stage you have come. If you come in stage 1, your chance of getting all right is almost 95% and above. Almost total curative work we can do, and you will survive absolutely a normal life if you come in stage 1. If you come in stage 2, maybe it will come to around 80%, 80 to 85%. You have got excellent good chance of survival, almost like 10 years, 20 years, you can say. Stage 3, it becomes less, because in stage 3, it becomes 50%. So that, your chance of, if you respond well, maybe you will have some 5 years survival chances is around 50 to 60% in stage 3. And stage 4, it maybe it's 10% to 15, 20%. In one good thing about this colorectal cancer, that in liver metastasis, a single liver metastasis, and if you which is considered as stage 4, can be very well treated by a newer chemotherapy medicine. If it remains still, we can do excision of that, and people can still have a good 5 years survival. Which, like any other stomach cancer, if you see, and stomach cancer has already gone to the liver, it is like a hopeless case. But in a colorectal cancer, if it has gone to the liver and nowhere else this is there, only it is liver there, then we can do excision, give chemotherapy, and then you can excise that. Even suppose there is a single oligometastasis in the lungs, we can do a long part of the segmentectomy or upper lobectomy, so that we can take care, and you can have almost a good quality of life and good survival even in stage 4. So that is the important part in colorectal cancer compared to the stomach cancer or esophageal cancer. They don't do that well once it goes to the liver, but in colorectal cancer, you have got a very good chance. Suppose your primary is very well under control, and suppose you have only developed one liver met, single liver met, after around 2 years, we can go in, we can be more aggressive, and we can treat you very well in all these stages. So earlier you come, the better it is. No doubt it is, it's earlier to come better, because the expenses of the stage 4 treatment is very high. You have to have targeted therapy, you have to have immunotherapy. The cost is very high. It will go down over a period of time. But even in stage 1, it is just straightforward surgery and you are out. So your expense is also less. In stage 2 also, there is no need of any chemotherapy or something. You can just come out with a good surgery. Stage 3, you require chemotherapy with surgery. And stage 4, you require all the gadgets, whatever accessory is there in our armamentarium. So the treatment wise, as I have told you, it is in one. First is surgery, then radiation, chemotherapy, target therapy, immunotherapy. So such a big armamentarium we have in the treatment of this colon cancer. Surgery is the most important part. Suppose if it's just a polyp, we don't know, it may not be malignancy, it may be just simple polyp. Then under colonoscopy, we can just do a snaring and just take out the polyp, send for the mild dysplasia. You don't have to do anything. Stage 1 is surgical removal of the tumor of the lymph nodes that we excise. I will show you in the next picture how we do that surgery. And we take out that much part of the colon, anastomose again, so that you have a good survival and you don't have to do anything else. Now, stage 2 cancers, sometimes you require adjuvant chemotherapy. If it's little bit just borderline 1 node positive and all, you can have a chemotherapy with after surgery. And stage 2 in a rectal form, we normally now give chemotherapy, radiotherapy prior, first treatment. After a month or so, we do surgery and we take out. That will have the excellent survival as per the new protocol which is there. And in stage 3, it is always surgery if possible first. And for a colon cancer, you can then give adjuvant chemotherapy. But for rectum, it is always chemotherapy, radiotherapy is the first. If there is excellent good response, we go in for surgery. And in stage 4, it is a combination of all. In sometimes it is inoperable, primary. Suppose in the local, the rectum, we can't operate. And patient is under this, we can do a colostomy, or we can put a stent across to, so that you can pass normal stool and you can treat everything. Then we can close the colostomy over a period of time after the proper treatment. So in stage 4, you will require almost all sort of treatment, right from surgery, radiation, immunotherapy, target therapy, chemotherapy, palliative cases. All these things will be needed, and the expenses are very high. So it is always better to come in time. And you will have some symptoms. If you immediately symptomatic, you must come immediately, get yourself investigated. This is what is called as colon excision. This is a polyp, and you pass that snare through the colonoscope, go inside, hold it, and then you have a current inside, which is like a cautery, what we see. You pass the current so that it burns and it heals that, it doesn't cause bleeding. And you take this for histopathology. So this is a very early, what's called as polypectomy, which can be easily done in a day procedure, and you can go home by evening. And this is the laparoscopic surgery. Now the colon can be excised through laparoscope, as well as you can do it by open surgery. Open surgery and colon surgery, the survival is more or less same. There is no change in any survival pattern. While if you do a laparoscopic surgery, your pain and other things, you can go home faster. Blood loss is much less compared to the open surgery, and chance of returning to the work is faster. So you can do a laparoscopic resection by a small incision and to remove the tumor, or you can do it by open surgery. Whatever it is, once the removal with all following proper oncological principles, if you do a surgery, laparoscopic and open surgery, it will both way patient will do same well for a long-term period. Yes, laparoscopy, the benefit is small incision, early rehabilitation, quick to the job. That's the important part. So suppose you have a cancer on the right side of the colon. then whatever this is a blue color, if you see that much area we need to remove. Even if it is a small cancer, we used to remove so much of colon. That is because the blood supply, once you cut, that much colon will not hold. So all excision of the colon, it doesn't depend just because it's a small tumor, we'll remove only that much part and get away with it. No, we have to go right up to the pedicle of the from where the vessel supplies to that tumor part. When we cut that, whatever part gets, which supplies all over part that needs to be cut, then we anastomose. Then we either with a stapler or we can do a hand anastomosis, whatever possible. So this is called as right hemicolectomy. Then we have a left hemicolectomy. Suppose the tumor is somewhere here, then we remove like this and join back. The tumor is in the central part, transverse colon, we remove transverse colectomy and then join back. Sigmoid colectomy, you do almost like a high anterior section. You remove that much part and join back again. Total colectomy sometimes we do because of ulcerative colitis or because of synchronous multiple tumors at the same time. Then you remove the full colon. Either you can do a artificial this rectal pouch, iliorectal anastomosis, or you can do very subtotal colectomy. That means keeping a very small part of the rectum behind, so that you can check them regularly. And sometimes if it is a very low cancer, you can give after radiation and chemotherapy, decrease the shape, and then you can ultra low, means very low. Only problem with this low cancer anterior section is that you will have motions around 4-5 times a day. But rather than having a bag, permanent bag on the left side, which happens if it is in the anal canal or a very low rectal cancer, then maybe you will require a permanent colostomy, which is, you need to study well, you have to use to it, and your day-to-day is little hampered if you have a permanent colostomy. So we try to as much save the sphincter as possible so that patients don't have to remain with colostomy for longer period of time. Yes, short period is sometimes possible because there is a lot of stool inside, it is not very well prepared colon, or it is very dicey colon, which we are doubtful about the healing part of it. Then we do always a covering colostomy, which is a temporary colostomy. So if you have a cancer here, you do a sigmoid colectomy. If you cancer here, you can do a stoma. Suppose it is an emergency, sometimes we do because of obstruction and all. You don't want to do this, then you bring out a stoma, which is like a stool will pass from with the bag inside outside. Over a period of time, once your general this improves, then you join it back. Or sometimes it is like a colostomy bag you can apply. This is like a sometimes permanent colostomy. Suppose you have removed the full colon roval part because of very low cancer of the rectum and the anal canal, then you will have to wear a permanent bag like that. There's very few people nowadays we get, unless the disease is like that only. But now better treatments are available. So we try to save as much as possible colostomy, which is permanent. And then the chemotherapy, which is the most common chemotherapy used, is FOLFOX chemotherapy or CAPOX, and then followed by FOLFIRI. These are multiple. It's almost 2 to 3 days admission. Most of the people admit. You can go home also with a, there is a this pump is there. With that you can go, if you are really well versed with all these things, then you can continuous chemotherapy, because it requires a continuous 5-FU infusion for about 2 to 3 days. Glycovarin, oxaliplatin is gone. It's a little tedious chemotherapy which is required, but loss of hair and all is not an important part in which is there in the breast cancer and other things. And in the rectal tumor, the chemotherapy and radiation is before surgery is to reduce the size of the tumor. There we normally give some capecitabine tablets, or even 5-FU can be given at that time. There is a targeted therapy. Suppose you have a little advanced disease with liver metastasis, then bevacizumab or alpelisib, these are the EGFR, VEGF inhibitors are there, which were very costly before, but now the cost has come down very remarkably, and it is now affordable treatment. Is an excellent treatment for a liver cancer. Suppose it has already spread to the liver, and then these things can really decrease the size of the liver to such that it is amenable for surgery. Then you can remove the surgery and you can continue the chemotherapy for some more time. So it is very important to realize that these targeted therapies have become a big thing. It is almost like for almost one decade old now, the treatment. And the new treatment which now see is the immunotherapy. Immunotherapy is that if you have PDL1, you have that this in your that special inhibitor, what you call if that antigen and antibody is there inside, then you can all this immunotherapy help. It is a very costly, but it can give rise to good palliation for a longer period of time. In some patients, I have seen in some lung cancer and all almost 1 year, 2 years, which we have never expected before, can do a fantastic job in a immunotherapy. This is all started with advanced patients, but over a period of time, I think it will become cheaper, so it can come in early stages also. The prevention of the colorectal cancer is best, as I have told you, vegetables is the ultimate. So there are 3 magic bullets to have a good, not only colorectal cancer, but in all types of cancer. The first is the vegetation, as many vegetables as possible. Eat a lot of diet rich with fruits, vegetables, and whole grains. Very important. Good exercise. Keep yourself fit. Do every day at least 2 kilometers walk or running or skipping or cycling, swimming, anything. And that's this. And last is stay away from the smoke and alcohol. These 3 magic bullets can keep away from all types of cancers. Some amount of prevention for those who are having family tree. And there was some like like my mother is there, suppose mother's sister is there. In that family, suppose cancer is there, then you have to be more proactive in investigating earlier this compared to the normally we advise somewhere around 40 to 50. But if you have a family in there are one family member positive, then you come around 10 years earlier, maybe 1 or 2 member family still earlier. So it's very important. Now there are genetic studies are available where you can do the studies and you feel that your chances of having this cancer is high. Then you can do all these studies, investigation in a very early this time. So as I have told you, being a physical activity, maintaining a healthy weight, stay away from the smoke and alcohol, and vegetables, as I have told you, these are the magic bullets to stay away from all types of cancer. And as I know, who should be screened? Anybody who is more than 50 years, anybody who has got history of colon polyps, and he has got a history of what you call family history is there, then he should do. With the younger generation, like we have seen now that incidence of colorectal cancer in younger adults is becoming more and more common now. It's almost increasing 2% every year since 2003. And American Cancer Society now recommends average risk screening starts at 45. I would prefer it to start for go once at least in the age group of 40s. So family history of more than 1 first-degree relatives of CRC starts at 40, around 10 years before the diagnosis. The first-degree relative with advanced polyps, you start at somewhere around 40. If you have a history of advanced polyps, inflammatory bowel, like ulcerative colitis and all, you should do almost every year to once in 2 years. So in summary, colorectal cancer is a common cancer, but very treatable, it can give you a good life, almost curable cancer, I would say. You have to start screening somewhere at the age of 40s, but till 40 to 75 years, you should do a regular checkups. Family history and personal history is very important, so that you have to, if you have family history, still earlier you can do it, started around 30s and so. Screening, colonoscopy, screening like a stool for occult blood, colonoscopy are very important to early detect of the cancer. A healthy fiber-rich diet, good vegetables, good exercise, avoid alcohol and tobacco can lower your risk of developing colorectal cancer. So it is a very important, and you can have a now better treatment available. So don't give up. You can treat well. We can give you good quality of life. Thank you very much. It's time to get yourself screened. Thank you very much.